Good afternoon, sir. Good afternoon, classmates. I am Miguel Magno, BS Psychology. Brain damage is an injury that causes the destruction or deterioration of brain cells. There are two types of brain damage. First is the traumatic brain injury, which is caused by an external force, such as a blow to the head, that causes the brain to move inside the skull or damages the skull. This in turn damages the brain. The second one is the acquired brain injury, which is most often associated with pressure on the brain. This injury could come from a tumor or it could result from neurological illnesses, as in the case of a stroke. The severity of brain damage can vary with the type of brain injury. A mild brain injury may be temporary. It causes headaches, confusion, memory problems, and nausea. In a moderate brain injury, symptoms can last longer and be more pronounced. In both cases, most patients make a good recovery. Although even in mild brain injury, 15% of people will have persistent problems after 1 year. What causes brain damage? Cause of traumatic brain injury includes car accidents, blows to the head, sports injuries, falls or accidents, physical violence. Causes of acquired brain injury may include poisoning or exposure to toxic substances, infection, strangulation, choking or drowning, stroke, heart attacks, tumors, aneurysm, neurological illnesses, abuse of illegal drugs. What are some of the symptoms of brain damage? There are numerous symptoms of brain damage, whether traumatic or acquired brain injury, and they may fall into four major categories: the cognitive, perceptual, physical, behavior, or emotional. Cognitive symptoms of brain damage includes difficulty processing information, difficulty in pressing thoughts, difficulty understanding others, shortened attention span, inability to understand abstract concept, impaired decision-making ability, and memory loss. Perceptual symptoms of brain damage includes change in vision, hearing, or sense of touch, spatial disorientation, inability to sense time, disorder of smell and taste, balance issues, heightened sensitivity to pain. Physical symptoms of brain damage includes persistent headaches, extreme mental fatigue, extreme physical fatigue, paralysis, weakness, tremors, seizures, sensitivity to light, sleep disorders, slurred pitch, most of loss of consciousness. Behavioral emotional symptoms of brain damage includes irritability and impatience, reduced tolerance for stress, sluggishness, flattened or heightened emotion or reactions, denial of disability, increased aggressiveness. Gertzmann syndrome is a rare neurological disorder that can occur as the result of a brain injury or as a developmental disorder. The syndrome is characterized by the loss of absence of four cognitive abilities: the loss of the ability to express thoughts in writing, agraphia, dysgraphia, to perform simple arithmetic problems, acalculia, to recognize or indicate one's own or another's fingers, finger agnosia, and to distinguish between the right and left side of one's body. In such cases, in addition to the four classical symptoms, affected individuals may also have difficulty expressing themselves through speech and difficulty understanding another person's speech. Aphasia. They may experience difficulty in reading and spelling as well. And that's all. Thank you.